Welcome to TERRACE Truth Talkin'. I'm Joanna Bonaro, and today I have a very special guest and guest host. Today I'd like to talk about Jin Shin Jyutsu. And to talk about that, we have a certified Jin Shin Jyutsu practitioner and self-care instructor, Teri Meissner. Welcome, Teri.
Thank you so much for having me, Joanna. I'm really excited to be here.
Oh, you're welcome. And Teri has worked many places, but worked at Ronald McDonald House, the United Nations, Hope Lodge, New York City Hospital Cancer Centers, American Cancer Society, Gilda's Club, and I'm so proud of you, I have to say this, is the recipient of the American Cancer Society Hope Lodge 2010 Award in Medical Excellence Humanitarian Award. So congratulations.
Thank you so much.
And our guest hostess today is Martine Beyer, who is a psychotherapist and hypnotherapy practitioner and writer in New York City. Welcome back, Martine.
Hi, thanks. It's wonderful. I can't wait.
So Teri, Martine had told me about you, and you've been a previous guest host. Thank you. And I am fascinated by Jin Shin Jyutsu. So why don't you tell the audience about what it is?
Terrific. Well, Jin Shin Jyutsu, or JSJ, it can be known both ways because some people have a hard time saying all of the syllables. Jin Shin Jyutsu is a balancing and harmonizing practice, a relaxation and stress reduction practice, a mind-body-spirit practice, and a wisdom practice all rolled into one.
So it almost sounds like an entire philosophy of life that's emotional, spiritual, mental, and physical.
Yes, it is. And it's a very simple practice in the physical application of it, but the underlying philosophy is quite deep and layered. And it has traditions in the East. The roots of this practice is approximately 5,000 years old. So the origins of this practice follow the similar path of acupuncture and acupressure and yoga. It probably started in India several thousand years ago and wound its way through China, over to Japan, following the trade routes.
Yeah, I read it predates Buddha and Moses.
Buddha and Moses. And
probably got them where they got to.
Yes, exactly. It helped them along in their transportation practices. But basically, this practice has been around for a long time. It's referenced in the Kojiki, which is the Japanese ancient book. And those practices were basically handed down from teacher to student, and the information was sent down verbally. And oftentimes in those areas, those practices, when the teacher or the student didn't pass on the information, that information either was lost or it was put on pause for a couple of centuries and then rediscovered. Jin Shin Jyutsu, modern Jin Shin Jyutsu, was rediscovered at the turn of the last century by a Japanese sage by the name of Jerome Rai.
Okay.
And he taught a Japanese-American woman the practice, and she brought that practice to the United States, and she is responsible for educating not only people in the West, but now the practice is utilized on over 6 continents by practitioners all over the world. Even though there's not a lot of people who've heard about Jin Shin Jyutsu because it's a very quiet practice, there are quite a few people and practitioners, over 6,000 to 7,000 practitioners practicing all over the world.
Mm. And are they all as soothing? Do they all have such a soothing presence as you do?
Thank you so much.
That was one of the first things I noticed when I met you. I was like, oh, she has this aura of zen, calmness, and I love it.
I do have to
She
say,
knows all the points.
Yeah.
I do have to say that is one of my superpowers.
Uh-huh.
But each person who practices has their own different flavor that they bring to the practice. I tend to work with lots of people who have complicated medical projects. I work with regular people as well. But because of my presence in those areas, I've utilized my skills to be calm in chaos.
Now, I know I mentioned a lot of the specific places where you've worked, but overall, you work in institutions and financial center?
Yeah, so I work in a variety of settings. I work in corporate settings. I teach health and wellness seminars and workshops in corporations, major corporations, blue chip corporations. I work in hospital and medical settings. I teach Jyutsu self-care and stress reduction workshops for Gilda's Club in the cancer centers here in New York.
Which I really wanted to get into later, yeah.
And we can talk about that later. So I do a lot of that work. Plus I have a private practice where I see private clients individually, and then I also work with people who are in the hospital. So I also have a presence seeing private clients in the hospital. And several years ago, I worked in the integrative medicine department at Morristown Medical Center, providing this practice in pre-op, in respiratory neurology, and in the cardiac unit. So I would see patients before they went into the operating room, and they would get a Jyutsu relaxation treatment. I would see other people once they had their surgery in the recovery room. And what they found at the hospital, they were doing a research study, was that patients who had integrative practices had less pain, less nausea, less fatigue. They healed more quickly and needed less pain medication, and their hospital stay was shortened.
Fantastic.
I think your whole body relaxes so much that all of the blood flow, the oxygen, is just that on the simplest level, it's so healing.
Well, it's such a stressful situation to be in the first place.
Yeah. That's true. And one of the benefits of this practice is the stress reduction relaxation response, how it invokes that. It's really, really important because most people, as you know, if you have a health project that you're working on, it can cause a tremendous amount of stress and anxiety. And oftentimes, when somebody can just take a breath and pause, that'll allow them to actually get through the situation that they need to in a more focused manner so that they can deal with what's coming at them.
Mm-hmm. Well, the stress tightens the body, and immediately when you have someone like Teri there, it's so soothing that, it's almost like somebody saying something or touching you a certain way. Just on that level, your shoulders just go down. You've seen that with the right words, the right touch.
I can just imagine, because if you're getting the operation, you're stressed. Even if you think you aren't, you are.
Yeah, of course.
And then the people around you who love you and who are supporting you, they're worried about you. They're stressed.
Absolutely.
So even if they're trying to calm you down and they're acting like they're not stressed, it's a vicious circle. Everybody's really stressed. So then you come and you have this soothing presence, and then you bring this procedure with you that helps it even further.
Right. It's amazing.
The thing that's amazing about the practice is that, again, what you had just described, I would walk into a patient's room just before they were ready to go into an operating room. So you've got patients, you've got caregivers, family members, and then you've got medical professionals all hovering around doing a variety of things that can be very disruptive.
And you're being poked and prodded and needles. And
which tenses you up.
And so for me, I would just go and lovingly put my hands on somebody very gently and talk with them and place my hands on them and teach them how to breathe and utilize the self-care part of the practice as well as the practitioner part of the practice, where I would teach them a couple of things that they could do once I left, if they had time before their surgery or after their surgery, where they could just hold their fingers and breathe, and that would take down the intensity and the anxiety. It would help to open up their oxygenation levels, and it would help them to really be able to deal with the onslaught of whatever that medical procedure may have been.
So within, let's say, a clinical setting, you've already been hired and you're there. Who would seek you out outside of the setting? Would it be people who heard about Jinshin Jyutsu, or people who are interested in Reiki, and then they're further experimenting, and then they're introduced to this, and then they come to you? How does that usually? How do people usually discover? I guess what I'm trying to say is how do you discover this?
Well, I discovered Teri. So we took a workshop together.
Okay.
To train in some hypnosis. And I do some glass work, and I got a sliver of glass in my finger. I didn't realize that I didn't get it out, and it was quite blown up when I came to the Sunday workshop. And I was like almost getting double the size. I'd gone to the pharmacist. They say you have to go and get prescription drug. I try to stay away from medication. So Teri saw it, and I said, wow, look at this finger. And she said, let me hold a certain places on your hand or an arm. I don't remember. We just sat and we were listening to the lecture. And I'm telling you, it started coming down. I was watching it go down.
She had a lot of inflammation. She had a lot of inflammation in her finger. Her finger was swollen.
It was an
And
infection.
this practice is
Yeah.
really quite something, because on the base level, it helps with your stress and your physical body, but it also helps with boosting circulation and helps with the healing process. So I was just gently placing my hands on her arm and her hand and her wrist and her finger, and the circulation came back into her finger, and the swelling went down.
That's amazing.
And that's
That's
what
amazing.
that kind of thing
Yeah.
happens. When we were in the hospital, we'd see patients, and their surgical incisions would heal more quickly. I mean,
once you witness that, you become an immediate convert.
well, lots of people
I
have
recommend it all the time now.
Everybody has their own unique experience. So some people, they have this wonderful relaxation response, and that's plenty for them. That gets them to a place of peace and chaos. Other people have a lot of pain, and once the muscles relax, their sensation of pain decreases.
That's true.
And that's super valuable. And then there are other people who, if they're anxious or they're nauseous, this takes them out of their head into their body to relax everything and to move the energetic pathways, the circulation pathways, and the body's healing response along, so that it balances them to actually feel better, whatever that is for them, because each person's response is different.
It's going to be different.
Every time they have a session, on different days of the week, at different times of the day, and from person to person, they'll have a different response.
Well, I didn't need medication for the finger.
Wonderful.
And the only other thing I did was a little bit of a charcoal pumice. That was it.
Well,
and it was down in a day or two from
what was
the pressure.
really interesting is when I was working in the hospital, when I first got to the unit, people on the unit, the doctors, the nurses, the staff, the anesthesiologists, they knew we were there, but they didn't quite know what we did. And they were like, we don't know what she does, but we think she might be helpful. So they would sometimes sort of send me in to see patients who were waiting a long time. And the patients got really calm, and they were relaxed, and some of them fell asleep, and they were like, wow, what did you do to them? I said, all I did was do a little Shin Jyutsu, and it stimulated their relaxation response, and they calmed down. They're like, oh my God, that's great. Now I can do what I need to do. So they saw value and change. Plus, a lot of the patients that I was working with had their vital signs being monitored at the same time that I was administering.
And for the scientific mind,
a
that's
Shin
sort
Jyutsu.
of a validation
So
once you see that.
So what was interesting is they could see changes in their respiration levels, in their oxygenation levels, in their heart rate, the variability of the heart rate. And honestly, I think that the anesthesiologists noticed first, because they needed to give less anesthesia for the patients that we saw, because oftentimes they see people and the people are very, very anxious, so they have to give them a little something to calm them down while they're administering whatever anesthesia they give them. But
that's highly beneficial.
It was very
to
beneficial.
get to a state where you don't have to have as much anesthesia. That's a big plus.
So, and again, each person's experience is different, but what would happen is that the doctors and nurses then started to notice changes in their patients, and they were like, oh, there's value. Then they'd say, you've calmed them down. Does this help with pain? And I'm saying, yes, it can. And then they'd say, oh, my shoulder hurts. Is there anything I can do for my shoulder? I'm saying, yes, you hold this area and breathe, and that will take the tension out of those muscles in your shoulder to soften that. And oftentimes people would say, I have a headache. What can I do for a headache? And I'd say, well, you can hold the space between your thumb and your index finger. There's an acupoint there. And just hold that and breathe. Or you can hold just your thumb and that point and breathe. And their headaches would start to decrease in intensity. So there are lots of value that this practice can bring on both the practitioner level, when you actually administer with a practitioner, when you place your hands on these different areas of the body called safety energy locks, which tend to be at the joints.
Okay.
And there are, in Shin Jyutsu, 26 safety energy locks on the front side and the back side of the body, on 26 on the front and back of the right side of the body, and 26 front and back of the left side of the body. And these points are similar to what you find in acupuncture and acupressure, except that in acupuncture and acupressure, the points are the size of a needle, very tiny and specific. Shin Jyutsu, the areas, we call them access areas, the safety energy lock locations are the size of the palm of your hand. So if I'm working with an adult, it's the size of the palm of the adult's hand. If I'm working with a child or a baby, it's the size of the baby's hand. So those areas tend to be smaller. They tend to be at the joints. There's a lot of circulation pathways that go through the joints and a lot of nerve pathways. And the combination of touch and breath brings on the healing response, the body's natural healing response, the relaxation response, and it helps boost circulation as well.
So what is the session like? Somebody comes to you
so
and
if
says...
someone's coming to see me privately, usually it's a 60-minute session, so about an hour, and people will be fully clothed, lying with their back on a padded massage table. They'll take their shoes off, maybe they'll remove their belt and any jewelry that might be sharp. But basically, I just place my hands gently on different points of the body, kind of like what people would experience in a Reiki session, because Reiki is a more familiar modality. It's a light touch energetic practice. So the touch is super light. So I could place my hand on your hand right now. It's as if I was softly holding a baby's hand. It's not, there's no pressure, there's no manipulation of tissue, there's no rubbing or massaging. It's a very gentle, soft practice.
Do you use two hands simultaneously, or is
I do, but you can do it with one hand for certain situations if that's required. But yes, there's usually one hand on one part of the body and one hand on another part of the body, and it just facilitates the circulation patterns through the body. This practice works on the skin surface level, the deep skin or fascia level. It works on the muscles. It works in the bones and the marrow. Physically in the body, it works with the circulatory system, the nervous system, lymph system.
Do you feel something?
I do, but because I have very sensitive hands, so I feel changes in people. There's also these energetic pathways that go through the body. So I feel energetic pulsation, or I'll feel an energetic texture when I place my hands on different areas of the body. And there's a certain rhythm and a tempo and a balance to that energetic experience. But also I can feel changes in the tissue. So if someone has a pain or discomfort, let's say in their neck or shoulder, oftentimes if you place your hand on that area, the muscles are contracted and they're hard. And when we practice Jin Shin Jyutsu, we gently put our hand on these different areas to open up those pathways. The muscles start to soften and open. The contraction starts to soften. Because basically, Jin Shin Jyutsu stimulates the relaxation response. It stimulates the circulation response and the immune function. So it helps the body start to rebalance itself. Like, I'm not doing anything to somebody, I'm just facilitating.
All right, and that brings me to another question which I had, which is, when you're talking about this, as it's different from Reiki, how do you say that?
Reiki. Yes.
Yeah.
What are the distinctions between Jin Shin Jyutsu and other massage or healing modalities like Reiki, like even getting a massage?
Well, that's a good question. So first of all, I'm a Jin Shin Jyutsu practitioner, and I'm also a certified Usui Reiki master. They used to like to use that term. I like to call myself a practitioner, level 4 instead. But so the difference between Jin Shin Jyutsu and Reiki is that Jin Shin Jyutsu, for me, has a slightly different vibration or vibratory feeling in that energetic texture. And I know that that's not, that's a little esoteric, but the way that I like to describe it is that Reiki is like an overall mohair blanket that's been put on you. It's soft, it's airy, it's ethereal. Jin Shin Jyutsu is a lot of it has that quality to it, but it's more like an electric blanket. When you put it on, it gives you an extra zhuzh where you feel it in the body, off the body, on the body, all of those things together. So there's more, it's a little bit more dynamic from my perspective in terms of how I feel with both practices, because I use both.
Well, what's interesting is because you just said that little zing, because I wanted to understand it. And the first time that I met Teri, she said, well, let me show you. And she sat right next to me on the couch and put one hand behind my shoulder blade and the other in between my thumb and forefinger. And I, all of a sudden, in literally like a minute, it was a minute.
I came out of the bathroom. She was looking like she was falling asleep.
It's that fast.
It was a minute. And I didn't know what to expect. I had no idea. And I wouldn't say I'm the most receptive individual when it comes to certain things. And I'm always like, give me a massage, and I want you to put my elbow in between my tissues and just grind, and so to me this is just so gentle, right? So I didn't know what to expect, and then all of a sudden, to make a long story short, I felt an electrical impulse in between my thumb and forefinger, and I said, I'm getting really sleepy now. I think I want to take a nap.
Right. Yeah, that's where I walked in.
That's beautiful. That's Jitsu.
Yeah.
And it can happen that fast, that simply, that quickly. I mean, that's why, when I see people sometimes, I'll place my hands on them and they'll immediately just go into the quiet place in between that wake and sleep. Sometimes in hypnosis we call it a hypnagogic state, but it's really
Never heard that term.
hypnagogic. Yes, it's sort
I
of
haven't heard that either. What is that?
it's the state between the in breath and the out breath. It's the pause. It's an altered state of it's an altered state of relaxation.
Hypnagogic. Okay. All right.
For those who are skeptical, although I was an immediate convert after that.
once you see your finger go down,
right,
or your body just
you're like, oh, okay.
yeah.
I'm sure you have encountered people who are skeptical because it does sound a bit esoteric. So, and I'm sure you have then converts like me and other people. Do you have any stories that you want to tell us?
Well, thank you for sharing your experience, because that's the best way to understand the practice, is to feel it in your body immediately. And there's an easy way to do that. Either you can go see a practitioner like me, or you can actually learn how to practice on yourself. So there's a self-care part of the practice, which is a combination of touch and breath. And when I teach health and wellness workshops in corporations, I walk into a place and I have a room full of people. One of the first things I teach them is a Jitsu self-meditation exercise where you gently hold your fingers and breathe. So we start with the thumb and we'll breathe 3 to 4 breaths on each finger, 3 to 4 on the thumb, and then 3 to 4 on the index finger, and we'll go through one hand and then the other hand. And that gets people into that really quiet relaxation state.
Do you count the
So you
inhaling
can.
or?
So when I teach a group of people, I like to have everybody have an experience, so we all do it together, and I guide it. But you could actually do it yourself. You can count your breaths, or you can just breathe a couple of in-breaths and out-breaths. When you increase your inhale and you make your inhale longer, slower, and deeper, and you exhale and make your exhale longer, slower, and deeper, you send a signal to your nervous system to calm. And you combine that with touch, a gentle touch on your finger, and that makes the relaxation response experience much deeper and faster. It's exponential how fast your body responds. And it's like priming your body. The more you practice, the faster your body will respond. It's like when you run a marathon. You can't just go out and get a pair of Nikes and run out and do 26 miles. You have to build up over time. So when I teach people, I teach them how to do some simple self-care exercises that they can practice over and over themselves.
So what I wanted to say about the hand, when you first showed it to me, and I do share this with people that I work with, each finger corresponds to an emotional state.
Right,
so
a different emotion.
The thumb is
the
worry.
thumb helps with worry.
Which I always teach. I say because it's hard for people to remember. The thumb is like, think of a baby calming themselves if they're
Yeah, I
worried.
was because I know about that. I said
Yeah.
wanted to make sure that our listeners understood what does each finger signify.
So we can go through that right
yeah,
now.
let's do it.
So the thumb helps with the attitude of worry. And as Martine mentioned, babies suck their thumbs. They suck their thumbs in utero. They suck their fingers. They're balancing and harmonizing their body naturally. Some people put their hand on their cheekbone. People cross their arms. They're actually accessing Jitsu points without even knowing that they're calming their bodies and their minds. So the thumb helps with worry and digestive projects. The index finger helps with the attitude of fear.
Which I say to people, if you think of forming the thumb and the pointer, because it's sometimes people want to use it and they like to know what the fingers correspond to. So if you do the thumb and the pointer, it's almost like a gun. I'm sorry, but it's fear.
Yeah, so I don't like that.
You don't
that
like
kind
that
of
imagery? Too
That's
strong?
That's not the kind of image that I prefer.
Okay.
But because I'm trying to calm people down, not ratchet them up. But so I like to think of the thumb as worry. The index finger is fear. It also helps with back discomforts as well, certain kinds of headaches and other digestive projects. The fingers are multitaskers. The middle finger helps with the attitude of anger. So when you think of New Yorkers, we tend to flip our middle finger at somebody when we're upset or angry at them. So what I invite people to do is to hold their middle fingers and breathe, and that will calm them down. So even if something happened that upset them or angered them, this will give them pause and the ability to calm.
Okay.
The ring finger helps with the attitude of sadness or grief. It also helps with respiratory projects. And then the little finger helps with the attitude of, we like to call it trying to or pretense. It's really the New Yorker's dilemma, having too many things to do on your to-do list and not enough time to do them.
So that's the pinky.
So the little finger helps with anxiety. It's the you show up with your New York game face on the outside and you're freaking out on the inside. So holding your little finger or your pinky and breathing will help to calm that attitude of anxiety and intensity.
So let's just go through that one more time, but very, very, like 1 or 2 words for each finger. So your thumb is for
worry.
Your first 4-finger pointer.
Index finger is for fear.
Middle finger.
Helps with anger.
Ring finger.
Helps with sadness or grief.
And pinky.
It helps with trying to or pretense or too many things on your to-do list. And a really good way to think about it is when you hold your thumb and the rest of your fingers, you help to get rid of worry fast.
Got it.
Worry, fear, anger, sadness, trying to.
Wonderful.
Oh, interesting. I always say that under anger, sometimes the finger next to under anger is often sadness. So that's one way to remember it. And if you do all the fingers, by the time you get to the pinky, your anxiety should be getting pretty low.
Absolutely. And
I like that.
So that's how people remember it. And then the center of the palm calms everything.
Absolutely.
Yeah.
Well, what's interesting
She's such a
with
good
the
student.
Yeah, what's interesting with the
Helps
palm,
people.
you are, but
Yeah.
you
I use
Martine
it.
always. I've known Martine for over a decade, and I go to Martine whenever I'm highly stressed, and she'll call me and she'll say, "Hi, how are you?" And I'm like, "I don't know if this was a good time you called me, Martine." And she'll go, "What?" And I'll say, "Well, let me give you just a minute of it." And then she tells me something wonderful like that, and
Right, touch your nose, touch the back of your arms. Or the cards are wonderful, which you haven't mentioned. They're Jyutsu or JSJ cards, which is almost just a glossary. So there was a loss that I had recently, and I looked at the cards, and for grief, there are 2 little areas just under the clavicle that feel a teeny bit more hollow. And so when I would lie down, I would just place my fingers there, and it corresponds to, relieving grief, acceptance.
So you're talking about,
Yes.
you're referencing actually safety energy lock number 13. So we talked about that there's 26 safety energy locks, and the one that Martine's talking about is number 13, which is actually 3 ribs down from the collarbone. And on most people, if you touch this area 3 ribs down from the collarbone on the right or left side of your chest, oftentimes that's tender. And if you have an area that's tender, that means that the circulation patterns, the energetic patterns, are not moving harmoniously through where they need to go efficiently, and that needs little help. So while Martine is gently holding Safety Energy Lock 13, that does help with self-compassion. Actually, the philosophical name for Safety Energy Lock 13 is love thy enemies as you love yourself, and oftentimes we're our worst enemy. So it's about giving self-love and compassion to yourself.
That's
And
nice.
it does help. Again, it's one of the safety energy locks that fits into the, we call the depths, which is very complicated, so I won't go too much into it. But the sadness and grief is a second depth project, and that also is safety energy lock number 13, lives there, and that helps to balance sadness and grief as well.
The thing that's wonderful is that you can just go to the cards for anything. I mean, if I have a headache, I'll just press places in the back of my neck or there.
So what are the names of these cards?
So the
What are
name of the cards is called Health is in Your Hands, and you can get them on Amazon. It's a wonderful card set. It was created by a Jyutsu instructor who teaches at the practitioner level. Her name is Waltraud Rieger Krauss. She's German. These cards have been translated into English, and they're great because they teach you very simple care exercises that you can do with Jyutsu. And as Martine mentioned, there is an index for symptoms, and there's lots of different suggestions on how to use the practice. And there are photographs for people who were really visual.
That
it
would
shows
help
you.
me.
It shows you
Positions,
where
yeah.
the positions
Yeah.
are, where the locations
Yeah.
are, and where you put your hands. So it's pretty self-contained and a great resource.
I use it all the time, and for myself if I feel something, and I often add that in for somebody who's going through something in my practice. It's just a really easy go-to, so it's good for people to know about.
And that's actually the great thing about Martine is that Martine uses all of these wonderful tools in her practice to help her patients. And that's the thing about Jyutsu is that it's very, very flexible in the practice, in that you can go see a practitioner, you can work on the practice yourself with these very simple exercises, and you can feel benefit fairly quickly if you practice.
Well, what's interesting when you say we self-help ourselves without even realizing it. I remember one night I was sleeping and I had insomnia, and all of a sudden I put my right hand on my right cheek, but the full palm of my hand, which is not something anyway I normally would ever do. And I immediately felt a sense of calmness. And is that similar to what you're saying, just the placing the hand on the cheek?
Absolutely, because think about it, and the area safety energy lock number 21 that you're referencing is at the cheekbones. And that is used in culture. If anyone ever thinks of Rodin's sculpture, The Thinker, the gentleman is seated and putting his hand on his cheekbone and he's thinking. When we think, oftentimes people will put their hand on their cheekbone. It helps digest our thoughts.
Interesting.
And when you digest your thoughts, you're reaching a place of balance and harmony, because those chaotic thoughts can calm. You're digesting them, you're thinking about them, but you're not overthinking. You're balancing that overthinking.
So, going on with the sense of what is a session like, you're doing, you're placing your hands and instructing one how to breathe, and then you're talking to them about various holding
So
fingers.
actually, oftentimes, so there's two different types of the practice. So when I have a private session, someone's coming to me for a practitioner-led Jyutsu experience, I place my hands on different safety energy locks on their body. Oftentimes they're fairly quiet, and they go into that quiet hypnagogic or relaxation response. Some people fall asleep. Some people are in that space between sleep and waking, where it's just that sort of floaty, quiet place, and soaking up the relaxation response. And then some people are very, very sensory aware, and they feel sensation in their body where they can feel circulation patterns move. They can feel muscles twitch and release. Oftentimes, like in an acupuncture session, some people get a needle put in and they feel a zing or a zip. So it can be similar to that. Some people have sort of like a meditative experience on the table. Each person's experience is very different. When I teach in groups or I teach self-care, the self-care version of it, that's when people are going to be holding access points, these safety energy lock locations on their own bodies, and we breathe together. Or I'll give them homework where I'll teach people how to do the self-care exercises so they can practice in between their sessions.
So have you had any kind of, right before your eyes, any remarkable kinds of, like my finger was kind of a remarkable moment. I relaxed very much. It was, for me, the sessions have been very meditative. And then you feel good. I mean, I left with a sense of well-being. But any other visual things that
So I've had people who have had bruises, really purple bruises, and they've had when you get hit with something, you bang something, and there's like a swelling, and there's like a golf ball experience where there's a lump, and then there's a bruise. And when we put our hands on, we're able to just gently hold in the circulation patterns. The body self-heals. So oftentimes 5, 10, 15 minutes later, the inflammation has gone down, the bruising has gone down and starting to dissipate, and you can start to see the colors change and it start to heal.
That's cool.
Or
That's great.
Oftentimes, there's a special Jitsu hold for burns. And I have a story myself, which was I had a bowl of soup that I was holding, and I spilled it into my lap. And, when you're wearing clothes, and so first thing I saw was like, my skin turned pink and red, and I pulled my pants off and basically put my hands on that area, and I gently held it for 15 minutes, and then the pink faded. Oh. And it didn't blister. The soup was so hot it should have blistered. It didn't blister. So if you can get to something quickly, oftentimes your body's natural healing process will kick in to help heal more quickly. My mom had a knee replacement surgery a couple of years ago, and the doctor who was doing her surgery allowed me to go in and be with her in the pre-op area, like I would do when I was working at the hospital. I would see people like that, and then also in the recovery area. So I was able to work with her. So she sort of was able to go through the surgical process. She was, 82 or 3 at the time, and she had a little bit less pain and discomfort. She didn't need as much pain medication. Her surgical scar, I worked with her for several weeks. I went out to see her, and I would work with her every day, giving her a session once or twice a day. My dad would do the self-help on her. Her surgical scar healed beautifully. It was this very thin line. It was very straight. It healed very, very quickly, and almost looked like it was like a thin silver line, like it disappeared. And when she went to rehab, people said, "When did you have your knee replaced?" And she'd say, "Just 2-3 weeks." They said, "We've never seen a surgical scar like that."
I wish I'd known you through all the
healed
various
so-
surgeries. You
healed
don't know
so
how long
quickly.
it took my scars to get to that point. Years.
And again, everybody's body's different. They're going to heal at different rates, and some people, heal with, more quickly. But this practice helps. And, when I worked at the hospital, I used to see a lot of people who were having knee replacements, hip replacements. In my private practice, I see a lot of surgical patients. I see a lot of cancer patients as well.
You touched upon that, and that's, as a cancer survivor, I find this practice very intriguing and interesting in how it pertains to helping people who are pre-op, or post-diagnosis, which is always a shock, and then going through pre-op and then post-op and treatments afterwards. Yeah. So you've worked with cancer patients.
I do a lot of work with cancer patients. I run 2 programs, one at the American Cancer Society's Hope Lodge, where we go and we provide Jitsu practitioner treatments monthly. So we'll bring other practitioners in, and I'll bring people in, and we see and give 60-minute relaxation treatments, Jitsu treatments to the patients, who they call the guests, who are the cancer patients, and their caregivers. And it's also open for staff. And what happens is that people find some relief, and the relief can be something as simple as, oftentimes the cancer treatments cause pain, nausea, fatigue, neuropathy, numbness. And these Jitsu treatments help decrease the symptoms that come from the treatments. So oftentimes I'll get people who have a lot of numbness in their fingers and toes that are chemo-induced, and they'll have a hard time walking because they can't feel their feet, or they can't do things because their fingers are so numb. And this helps the circulation come back into the fingers, come back into the toes, so they can start to regain some of their sensory awareness abilities in their fingers and toes. That's pretty remarkable, and that happens frequently with cancer patients and their caregivers. This helps with nausea. It helps with fatigue. It helps people who have sleep-induced insomnia. It helps them to relax so that they can sleep. And most people don't realize that, when you're in a hospital, it's not the best place to sleep. There's a lot of stuff going on, the lights, the noise.
Constant.
You're not comfortable. There's constantly interruptions. So sleep is really important for people to heal.
I wish I had known you, because after my surgery for 2 years, the changes in my constitution, I literally was living like a vampire for 2 years.
Look, I understand. I see a lot of people, and the other thing is that I've seen people who've had, surgery, and I'll see them, a couple years later where they still have tightness and they don't have full range of motion. And sometimes these practices can really start to open up those areas that have been a little jammed.
Do you give classes? I know I had gone to Gilda's Club for like 5-6 months when this happened to me, and I wasn't familiar with that at that point. But what do you do at Gilda's Club? Just because I've had some experience with it.
Yeah.
So I work with Gilda's Club in a couple of ways. I have taught at the clubhouse. I teach a series of different wellness workshops for them. I teach a Jyutsu self-care workshop, which I've been teaching in all the hospital cancer centers here. I go to Mount Sinai and teach in the cancer center there through Gilda's Club. I have taught at the Dubin Breast Center through Gilda's Club. I teach at the Gilda's Club Annex at Kings County Cancer Center.
So it's all, but a lot of
That's
it is
through-
self-care.
I would teach self-care,
Okay.
correct. At Gilda's Club, we teach self-care. At Hope Lodge, we have a practitioner program where practitioners come in and offer Jitsu for the caregivers and the guests who are also the cancer patients.
It's so critical. Like these alternative, methods were looked at with raised eyebrows and like it's woo woo, and then you start to look at the physiology and the brain research, and there are so many things that can be done to help people with feeling helpless when they've got a diagnosis like that, supporting them to feel hopeful in terms of recovery. You start to be able to do a lot of things yourself. I mean, it's really important for people to know about the other options that are not specifically medical.
Well, what's beautiful about these practices is that they are complementary. So they work with
Right.
medical procedures in a beautiful synergistic way. And that's why the hospitals, this practice is used in quite a few hospitals in this country and in other countries as well, because it's gentle, because it has benefit. It's not difficult to do. It's easy to implement. And the other part is you're empowering your patients to be able to help themselves in between, or to calm themselves in between, or to allow themselves to get deep rest so that they can heal. I mean, that's really, for me, the biggest wow with the Jitsu is stimulating that relaxation response so that your body can self-heal.
How did you become interested in this?
Long story short, years ago, my kids were little, and we had a very creative doctor who, my daughter wasn't sleeping. She was going through a medical procedure. She wasn't sleeping. And he said, why don't you go see this practitioner? So I took my children to see this practitioner, and I was shocked because my daughter used to get really wired at night, and she was on this practitioner's table. Within 5 minutes, she fell fast asleep. Within 5 minutes, she fell fast asleep. And I was just like, oh my gosh, what is this? So I had to learn more. So then the practitioner had given me a self-care book, which I kept and looked at occasionally. And then I started to go see a practitioner myself because I was like, wow, look what this did for my kids. Let me investigate a little bit more. Plus, I've always been interested in lots of different wellness practices. I started practicing yoga when I was 17. I'm 60. So, I mean, I've been meditating since I was 17. I've been practicing yoga since I was 17. I've always had an interest in hypnosis and a lot of the other modalities that are becoming very, very popular today. And it's like this beautiful resurgence. What I love is that everything old is new again. And these practices are terrific because there's not a lot of downside with them, because they're gentle and there's really not much contraindication with them.
It can't hurt you.
These
thing.
Jitsu can't hurt you, and it may create a situation where it can be very helpful, allowing you to have some control over your response to what's happening.
Well, it appears to me overall that it's a sense of relaxation, centeredness, focusing on breathing, and the caring sense of touch, whether it's self-touch or someone else who has a soothing touch, which just basically it's like when someone's crying and you just put your hand around their shoulders. There's a sense of another human being is there. I'm there for you. I'm centering. That touch is centering. It's not the same thing, obviously.
No, it is the same thing, actually. What you're describing
Soothing,
is
comforting.
Jitsu is like a great big hug.
Yeah,
And you
sounds
can
it.
do it on yourself.
But the more you know about all of these different safe energy locks, the more, when you become more knowledgeable about self-care, you can then touch those various points,
Right,
and create that sensation of caring yourself,
right
for
well,
yourself.
But what's so
Right.
beautiful is that
Yeah.
you really need to know anything about the practice except that you place your hand on an area, like you can hold the area on your shoulder, and you can place your other hand on the same side of your hip, where your thigh meets your hip, and you can just breathe. You just breathe in and breathe out. You don't need to know what that actually does to feel benefit. And that's the beauty about the practice. I've taught children as young as 2 and 3 how to use this practice, and I've taught people as old as 103, when I was working with them in the hospital, how to calm themselves. So you don't need to know a lot, but if you want to know more, you can get a book like Health is in Your Hands, which is a super simple book that you can get on Amazon, and then start to see where you can place your hands, because there are pictures and photographs and easy instructions on how to practice.
And if one were interested in becoming a practitioner, how long does it take to become certified or become a master practitioner? Is there a course of study? Are there programs? Are there institutes?
Great question. Yes. So first of all, there's a couple of different pathways to learn the practice. There are 24 to 5 Jinshin Jyutsu practitioner instructors who travel all over the world teaching seminars on how to practice Jinshin Jyutsu. So there's that practice. There's also a certification program that's being offered at Morristown Medical Center, which is a professional Jinshin Jyutsu practitioner program, certification program, which is open to people who are interested. They can be medical professionals, they can be massage therapists, they can be just regular lay people.
Morristown is in...
Morristown, New Jersey.
Okay.
So they have a year-long certification program, which is sponsored by the hospital, Jinshin Jyutsu Inc., and is being recognized by AHNA, which is the American Holistic Nursing Association. So they've developed this course with all of those influences there. But you could also just go to you can go to my website to get the link for JSJ Inc. So my website is www.jsjnyc.com, and there's a whole resource list that has information about Health in Your Hands books. It has links to self-care videos that you can practice along with. There is information about Jinshin Jyutsu Inc., which is the national organization that provides the certification programs and the practitioner level courses.
How long do those take?
So the Jinshin Jyutsu professional certification program at Morristown is a year-long program. So it's a monthly program. It's a year-long program. There is an exam and a body of work that you have to maintain. And the other coursework, which is to become an authorized Jinshin Jyutsu practitioner, is provided through Jinshin Jyutsu Inc., which is their website, jsjinc.net, and you can take classes anywhere in the world. So I can take a class in New York. They just had a 5-day Jinshin Jyutsu class here in New York. Classes are offered in the United States, in New York, in California, in Texas, in many of the 50 states, as well as classes in Europe, South America. There are classes in Abu Dhabi, in the Middle East, in South Africa.
We actually do have some listeners from Abu Dhabi. So
Oh, really? That's great.
Yeah, there you go.
Yeah.
No degrees of separation.
No degrees, yeah, so that's good to know.
You can also go to classes in Hong Kong and in Asia as well. So there are classes that are run all over the world, and people come and attend them.
Is it commonly used in Asia now?
Believe it or not, there's quite a large community in Singapore and Taiwan and Hong Kong.
It started.
Well, so the practice actually started the
India.
modern.
Yes.
India was when. Okay, so going back to the Silk Route, but modern Jinshin Jyutsu was really rediscovered at the turn of the century in Japan.
Oh. Okay.
So it at that point, Jiro Murai had read the Kojiki and had access to all of these ancient records in the emperor's library. So he rediscovered the practice because he was able to go through ancient texts. but the practice now, there are practitioners in, all 6 continents.
Well, this has been wonderfully informative. Thank you,
My pleasure.
Teri. So I just want to review your website again is
www.jsjnyc.com.
And for those of you who just want to look up Jinshin Jyutsu, you spell it JINSHINJYUTSU. So you can Google that. And I wanted to give a book recommendation, which Teri, by the way, Teri, spell your name so that if people want to look you up, I don't want to misspell it for everyone.
So it's Teri, Teri. My last name is Meissner, M as in Mary, EISSNER.
You see, I'm glad you did because my notes were incorrect. Sorry.
Hold your palm. Hold your palm.
The book that Teri has recommended and mentioned, but I'll just give it to you now if you have a pen and paper in your hands, is Health is in Your Hands, Jinshin Jyutsu, Practice the Art of Self-Healing. It's a book and card set, and Teri showed me the cards. I'm getting this book and these cards. They're wonderful. They really are wonderful, especially if you're a visual person like I am. It's incredibly informative, and the pictures it's basically your kindergartner. You can do 1, 2, 3. So,
And it works.
And and the book is by Waltrid Reger Krauss.
Waltrid Rieger Krauss, yes.
Rieger Krauss, WALTRAUDDER-KRAUSE. So that is our book recommendation for Jinshin Jyutsu today. And thank you, Martine and Teri. This has been very informative.
You're welcome.
To help
Thank you.
us with our physical, emotional balancing. And let's just close with our favorite motto. Remember,
Kindness counts.